As a child, I would speak to everyone in my proximity. As I grew, that expanded to include those in Yahoo chat rooms and MSN Messenger contact lists. And I still start conversations now with an ASL.
Yeah, but
You know, like age, sex, location, anyone?
I remember what.
Always driven by insatiable curiosity, I sate myself with stories. Always seeking to connect, I derive energy from external sources. So let me bask in your glow. Let me laugh at your jokes. And when we move past pleasantry small talk, let me take on your burdens. I'll try to do so with caution, like how Gordon Bombay taught us to pass chicken eggs with hockey sticks in the first Mighty Ducks film. I'll try to receive your passes gracefully, whether on ice or on the streets, or in these clinical encounters where I'm now expected to utilize this curiosity to determine pathology. Seeking meaning-enforced, meaningful interactions at a time of one's worst crisis. Analyzing for a constellation of symptoms in the context of an individual in an hour-long conversation. Making diagnoses and treatment plans based on guidelines and evidence and experience and knowledge and subtleties in language. Take this anguish, make it vanish. Take psychosis and their voices and make choices, make them better. Take these letters about suicide and what's inside and make sense of it. Have them confide and find a fix. Make it portable enough to fit inside a pill. Make it happen quick with no refills. Make it happen quick. Then move on to the next one on the list. And gratitude is it's not a given. We're not curing cancer with how we listen. Our treatments take time and they don't always work, so our patients get asked if their illnesses are real, while we get asked if we're actually physicians. We listen to stories of trauma and try not to become traumatized. We have anxious people who have anxiety about treating those with anxiety. They ask us to not become addicts, which seems dramatic until you're faced with high stakes and no solutions and a ladder that leads to you. Where do we climb to? A yoga class? They handed out ice cream sandwiches at a resident wellness day. They ask us to get therapy to deal with giving therapy. We are the ones who get blamed when a battle is lost because our battle lines are ill-defined, perceived as figments of mind, as if somehow the brain is simply a serotonin boost away from happiness. Norepinephrine getting in the way of true meaning. Dopamine, all that separates someone from silence. We're not surgeons or cardiologists, and I'm not a psych apologist. All I want is just maybe a handshake instead of literally dodging fists. Maybe some routine instead of chaos, 20 hours into 24-hour shift. Maybe some knowledge about why we do what we do. Maybe a thank you. Maybe some gratitude.